always a problem when you're navigating two very complex systems, Medicare and Medicaid.
And people who are on both programs don't know where to turn to get their needs met. There are gaps in their coverage that don't get filled. So people end up getting fragmented care, which actually hurts their health.
These demonstrations work to integrate Medicare and Medicaid health services for dually eligible individuals.
We fully support the idea of integrating Medicare and Medicaid because of the value that we see to the consumer when it's done right. And so our goal is really to make sure that it's done right.
And hopefully ensure that beneficiaries were getting high quality, really well coordinated care.
And one of the key ways that we do that is really listen to the voices of the consumers. And how do we translate those voices and what they're telling us into how we implement and the policies we make connected with our duals demonstration.
It's really important for me that providers are a part of this process from the beginning.
I'm not particularly political, haven't engaged in a lot of advocacy, but I was really excited about the development of integrated financing in Ohio.
When I was asked to join this, I confessed that I knew nothing about what was going on at these state-level initiatives.
I was brought in as a provider or a physician advisor.
I called my professional association, the American Geriatrics Society, and said, who should I talk to? And they referred me to Renee Marcus Hoden at the Community Catalyst. And then she connected me with Kathy Levine and the people in Ohio that are working with Community Catalyst.
We developed a set of guiding principles for what we thought people in these programs should have.
And it's made it possible for me to have some influence on the development of the financing demonstration that I couldn't have had on my own.
So having the input from providers on how things are actually working has been crucial in talking to the state or to CMS about what it is that actually needs to be done.
It was really heartening for us to be able to talk about some of the challenges that would be in place and then actually be heard from a policy level to be able to make some changes.
This opportunity to work, to me, is breaking down the silos. We need to talk more with each other, the community, the acute care settings.
Bringing more of a geriatric perspective will be so beneficial because this whole world that they may not know about of community supports and services that really help people remain in the community and address needs beyond the medical condition.
Working with that population of people, physicians learn fairly quickly that you need help from other disciplines to be effective.
We really depend on social work and nursing and physical therapists and pharmacists to bring their expertise in to take care of the whole person.
I always tell them, I'm not actually trying to turn you into a social worker, but if you want to be effective, you better know a social worker and you better have their number on your desk.
The cookie cutter approach doesn't always work. The team has to be flexible because it's going to be different for every single patient.
To hopefully make the person healthier, to keep them out of the hospital, and to really have a better quality of life. That's really what we're looking for.
But the most important piece of it is for them to sit down with us with the plans and share what isn't working.
It's important that they know where they can turn when things go wrong and who they can call.
Because who better than consumers and caregivers know what they need in order to lead a productive life and stay in the community.
These demonstration projects are trying to achieve better coordinated care, better access for the patients, better education regarding their disease processes, and really encouraging self-management.
And I'm hoping the demonstrations actually allow people to see what it is that dually eligible beneficiaries are dealing with on a daily basis, why they have the needs that they do, and why it's so imperative that the care that's provided to them is coordinated, is high quality, is fair. It is a bridge to health equity, particularly for people who are lower income and in communities of color.
I've seen a lot of changes, so I think this project has great potential to impact the entire system.
I'm hoping that in 3 to 4 years that these demonstration projects will be able to show the value and the power of truly coordinated and integrated care.
I think the Duals project could really serve as an example of what healthcare should be.
I think we can show that that's not the care that only people who are dually eligible or people who are elderly or people who have disabilities deserve, but I think all Americans would demand that kind of care. And if we can show that, it would be incredibly powerful.